plastic surgery is kind of the last true general surgery type of specialty.
I get a question a lot like, what is your favorite surgery? The answer to that is, man, on what day? I mean, there's a lot of misinformation out there, especially because patients don't necessarily know all of the information. When they go to see somebody, they're like, I thought this guy was blankety blank or this woman was blankety blank. And it's because they misrepresented themselves because they're trying to make money. And it's very difficult for patients to like truly understand how complex the system is to drill down on like, who's the best person for you to go to for your surgery?
Totally. Because even, within plastic surgery, I think a lot of us tend to do more things than others. And not that you always have to go to the person who does the most rhinoplasties or the most tummy tucks or the most carpal tunnel surgeries. But there is something, I think, to be said that for someone who does something repetitively, if they do a good job at it, they're probably going to keep doing a good job at it. Now, you could do something, I think, really poorly and do it all the time, right? But I think you're right. There's this whole vetting process where it's like, how do people navigate that? And, I think social media can be helpful, but it can be very deceiving, too.
Absolutely. I mean, social media can definitely be a trap for ads to get people to go to folks who aren't appropriately trained. And you're right in saying that, like, if you look on somebody's website and they do a million tummy tucks and they're all great, it's like there's a good chance that you're going to get a good tummy tuck from them, but it seems unlikely that if you get a facelift from them that it's going to be amazing. But there are like that rare surgeon who's just like a surgeon. They're just like good at it. They like truly understand like everything. But that's like, it seems so rare. It's like everybody really drills down to the things that they are kind of best at.
Totally. When I started my private practice, when I left California, came back to Utah, I thought I wanted to do everything. I was still doing hand because I did a hand fellowship at USC. So I was doing trauma hand, replants, all that stuff, revascs, bone fractures. And then in the daytime, I was doing, the mommy makeovers, breast surgery, and I was trying to build my practice. Then I started doing facelifts and rhinos. And I was like, I just want to do it all. But then as I started doing it more and more, I kind of niched myself down. I stopped taking call because I got old and tired. So I didn't want to be up all night. And then, I was like, I just want to focus on, kind of the breast body. And I've learned to love that. But I think what's cool that you, Sean, what you do, I mean, you, like I said, you still do reconstruction. So you're kind of doing everything still, which is super cool.
Yeah, from day to day, my day can be totally different. And I think that's one of the interesting things. I get a question a lot like, what is your favorite surgery? And the answer to that is, man, on what day? Honestly, because some days I'm like super amped to dive in on just like a gigantic mommy makeover. It's going to take, 6.5 hours. I'm going to be sweating the entire time. And it's like, I'm very excited about that. And then other days I do like 5 carpal tunnels and it's like, it feels like 40 minutes of work for the entire day. It's mostly just surgical turnover. I'm like, that's pleasant as well. And every single one of those patients is going to do amazing and feel super duper happy. So it depends. I have swings on it, but I really enjoy the variability in my day. So it's like tomorrow I have carpal tunnel and I have fat grafting and I have a top surgery and I have a breast reconstruction. So it's just a lot of different things going on. Yeah, keeps it interesting.
Yeah. I think, they always talk, you think about all the different subspecialties in surgeries, even specifically. I mean, plastic surgery is kind of the last true general surgery type of specialty because we're doing everything, like you said earlier, head to toe, any age, any gender. It can be reconstructive, it can be aesthetic. And so it's nice that as surgeons we learn all of it in training, or almost all of it. You have to be able to graduate and to be able to get board certified. But then you can really kind of pick what you want to do. That's what I think I love about our field. It's never boring. Like I'm never bored. And even if I'm doing mommy makeovers or breast surgery, I'm constantly trying to find ways to innovate and improve my own techniques and kind of push the envelope forward. That's what I love about plastic surgery is innovation.
Yeah. I also think one of the nice things is you can always pivot. I feel like there's a lot of surgeons who are in a position where they're kind of in a job doing not necessarily what they want to be doing. They feel trapped. And for you, if one day you're like, you know what, I'm over the mommy takeovers, I can't do it anymore. I'm going to get a job at Kaiser and like do breast reductions. It's like you totally, absolutely could do that. It's like you have
Crush
the
it
ability
out.
to, you have the ability to pivot to something a little bit different if that's what you wanted.
I think, yeah, like if you think about any other specialty, like I can't be a neurosurgeon and be like, I'm going to pivot. I'm just going to go like do different types of neurosurgery. I guess you could go do like, some of those insurance cases or what are they called through like, legal stuff. But there's really not much room, or even anesthesia. Like there's not much pivoting. I think plastic surgery, like I said, you can pivot. You can go to a hospital. You can be academic. You can be on your own. There's so many things you can do, which I think just makes it super interesting. And like I said, I think I have severe ADHD. We'll see how long I last on this podcast. No, I'm just kidding. But
I'll have to
I think
replace you.
yeah, I guess somebody else here next week. No, but I really think this specialty has kept me like very well like entertained in my own specialty. I love it. Like I really do love it. I just love it more and more.
Although when you talk about neurosurgeons, right, neurosurgery is a surgical subspecialty that you then can get board certified in cosmetic surgery if you do a fellowship.
Okay.
So
yeah,
you
you've
could do a
talked about
fellowship,
this.
and then you could do what we do.
Yeah. I don't think there's any like 1 year like neurosurgery. It was like, hey, I'm just going to go be a neurosurgeon. You probably could, but like, okay, so why is this, dude? Why do you think that like a neurosurgeon or a OBGYN or a general surgeon, family practice, why are they wanting to do cosmetic surgery? Cosmetic. We don't call it cosmetic. We call it aesthetic surgery, but they call it cosmetic. Like, why is that, dude?
Money. I mean, I feel like these are some of the people that can feel trapped in their job, and they're like, hey, it looks nice over there. Maybe I should make a change, do a 1 year fellowship, and then I can just do that instead. I mean, and that feels attractive. I would probably consider it if I was a neurosurgeon. I didn't see a lot of like super happy neurosurgeons. Apparently there's a few here and there, but for me, it's really, really tough, super stressful stuff. And if you're getting burnt out and you want an out, I mean, that's a decent out.
Totally. I think, nothing. Obviously, like we all go to medical school together. We all get exposure to a lot of different areas, and I can see occasionally some people say, "Hey, I actually didn't know much about plastic surgery, and that's what I want to do." But I think so people try to find different avenues. But I totally agree with you. I think the majority of the reason why is they look at it like this is a cash pay system, especially if you're doing aesthetic surgery or what they call cosmetic surgery. People are coming in paying cash, paying ahead of time, right? Insurance is the opposite. It's like you go do a case, you may or may not get reimbursed. It may take 90 days, may take 6 months. And you think you're going to get $800 and you get 400, right? And so you can see this where people just get frustrated with what they are doing day to day, and I see how that's enticing to do that, but patients don't know that. And the problem is there's so much deception that happens because they don't want people to know that they're not actually plastic surgery trained. They just want people to know, like, hey, I can do this procedure, right? Like, I think I can do it. That's what's scary to me, and that's why I think you and I are both constantly trying to educate online. Like, you guys, like, you need to know their credentials. What did they train in? Are they board certified? What's that board? All that stuff.
Yeah, I think one of the big ones and what really highlights what somebody did for their training, because you have people who are board certified in cosmetic surgery, which people are like, oh, they're certified to do cosmetic surgery, so they can do that. But it's like you should always ask your surgeon what they studied in residency. That's like the hardest thing to like hide where you spent most of your time, because if you spent 7 years in neurosurgery residency and then you do a 1 year cosmetic fellowship, are you truly a cosmetic surgeon or are you a neurosurgeon who does cosmetic surgery?
Oh, I like that.